So at HEHA, we presented our abstract on the real-world use of olutasidenib post-Venetoclax. And as we know, olutasidenib is approved in the relapsed refractory setting. And the phase 2 trial that led to its approval was interesting because the duration of response was actually really long, 24 months. And one of the challenges that we were, sort of trying to look for is that does this actually maintain itself in the real world setting? So that was the intent of the abstract, and we took, it was a chart review of 9 academic and 9 community hospitals, so it was a mixed bag, and they all had to have failed Venetoclax, so it was a relapse after Venetoclax use. Obviously, any other IDH inhibitors was, not allowed in terms of the exposure. And what was interesting, 2 things, is the CR/CRh rate, which is an important indicator of clinical benefit, was actually 60%, which is much higher than what was even observed in the clinical trials. And if you count the morphologic leukemia-free state, which we sometimes debate whether that's a response or not, then it was almost 90%. But if you're just purely thinking CR/CRh, it was 60%. And the duration of response was actually 34 months, so it was sustained. So this is very much validating what the phase 2 studies were showing, that there is a sustained response. This is important because in the time when these IDH inhibitors were approved, nobody was at that time being treated with Venetoclax as a frontline management. So the population we're seeing now are the people who have already seen Venetoclax. So having data on can you use olutasidenib in this setting with a CR/CRh of 60% and a duration of 34 months, this is looking very good. So I think the intent of the study was in the real world setting also. These responses are being observed, and they're in fact better than what the phase 2 trial that led to its approval.